Okay, so for some of you folks on our end, this is an organization you may already be familiar with, and for some of you, this may be fairly new. But CliniSync is a health information exchange here in Ohio, based out of Columbus. And my first exposure to them was in a prior life over at Child Guidance and Family Solutions, where I worked closely with Scott and Cathy through our Meaningful Use initiative over there several years. And then after, I've been here now just over 3 years, but I think about a year in, we partnered with you folks here at Red Oak for some of the same services, access to the community health record, and we're now, well, we're utilizing Notify, not to the extent and the way that we should, and we're hoping to change that. So that's part of the reason for this call, is to just have everybody become familiar with your organization, what you do, some of the services and support you provide, and to kind of regroup on this end so we can move forward. And this actually, my interest came from a prior presentation sponsored by United Healthcare that I was on, and I thought a lot of the information there was very relevant, and so that more of you should see that and become aware of it. And some things they're doing with a referral tool, and Unite Us, Unite Ohio, Ohio Rise, and so on and so forth. And then I'm sure they'll also talk about, I would like to talk a little bit about the purpose or incentive for us at some point to contribute to the community health record as an organization. So if you all can address that as well. So with that, I will hand it over to Cathy and Scott.
Thanks, Bob, so much. We're really glad to do this because Scott and I present so much to people around the state, but we find it's so much more helpful to do it at the organizational level so we can answer your questions. This is very informal. We're doing it strictly for you. And so if there's anything that you have a question about as we go down the through the slides, feel free just to stop and ask it. You know, we're very informal here. So Scott, why don't we go on? Let's start. I think Bob put it in a good light, in the sense that probably the best thing we can do is walk you through a little bit about the background, since some of you may not have a lot of familiarity with health information exchanges, what we do, how we operate and stuff. So we'll start there, and then we'll tell you about some of our initiatives related to what's going on in Ohio, social drivers of health, what's going on with that, behavioral health regulations at the federal level. So we kind of cover the whole map when it comes to slides. So, you know, Absolutely. Just stop if we're going too fast. So go on, Scott. The first thing, just to tell you, Health Information Exchange, we are the electronic highway that connects all the healthcare providers in the state. We have 156 hospitals. We have thousands of providers, tens of thousands of providers connected, probably close to 800 long-term and post-acute care facilities. We've got, oh gosh, that 60 plus is way too low on behavioral health. We're in the hundreds on behavioral health. And we have pretty close to all the FQHCs in the state are connected in. And the end result is we have data on that. Again, these are old numbers here. We have data on almost 18 million unique patients within our system. And when I say data within our system, we don't have like a huge building where we house all this data. We do data warehousing. We have a record locator service and a master patient index. And so each organization controls their own data. And when someone needs data about one of your patients, our system bounces out to all of our sites and you know, looks to coordinate the information on that patient, brings it back in within seconds into a unified record, so you can look at their information by encounter, you know, by date, by lab results, whatever it is you need. And we'll show you some of that as we go down the page. But But that's our function, is to help data flow amongst healthcare providers to provide better care coordination for patients. So, and we have, Scott, we are going to have to update this slide. The connected EHRs, we actually are like 85 different electronic health record systems that we are connected to. Okay, go on. Yes. Anybody who says they want to connect, our technical guys will do it. Here are all the hospitals we're connected to. And I know you all are located in Akron. I don't know if you have any sites remote to Akron, or are all your functions within Akron?
Akron's our main site.
Yes.
But we're in the surrounding counties, so.
Oh, okay. That's what I was wondering, if you're considered Northeast, Eastern Ohio. But as you can see, we are connected, certainly in the area in which you are, with virtually every hospital. And so if you have patients who show up in an emergency room, or who are getting lab work, or have done inpatient at any of these facilities, you can get information on that coming through CliniSync if you query for them. Okay, so go on. We put in this roadmap slide just so you understand what we as an organization are trying to do, because we are coordinate so much of the data in Ohio, and we feel it's our responsibility to support Ohio initiatives, whether it be they Medicaid or other initiatives on population health. We did a lot of work with the Ohio Department of Health during the height of the COVID era, and we are our next round of initiatives we've highlighted in red, and those are social drivers of health, work on substance abuse treatment. The technology is, we'll talk about the referral platform, which is just coming up for SDOH. And then on the right-hand side, we are going to be spending, probably as one of our top priorities in the coming year, huge amount of time on education on providers, to providers, on what are some really significant initiatives. And the very last slide we have is about the new federal regulations that have been proposed that are going to affect you all. And we will about consent, and we'll be doing a lot of education around that. We have a lot of population health tools that we're working to make sure are out in the community, and anything that's being done to improve statewide initiatives. And we do work at the county level too. And this particular little factoid doesn't impact you as much as in other areas of the state, but there has been for many years a separate HIE in the Cincinnati area, and we are actually combining with them over the next year, and so there'll be one major HIE for the whole state. And that, I think that Cincinnati and Southern Ohio people are very pleased about that, to have that level of coordination. Okay, go on. Okay, so let's talk about specific services. I know Bob had raised this. One of the things, and where we had started as an HIE, was delivering results from the hospitals out into the community. And so we have tens of thousands of connections out there for various providers. So if you tell us where you need to get lab results from, or you need radiology reports or whatever it is, then our technical guys and our technical person who handles your account is named Billy Klein. He's one of our best guys. And you just give him the list of hospitals where you need information. He will make sure that it comes back to you and gets built right back into your system, so it is delivered into your patient chart. And Bob, I'm sorry, I should know this, but I don't recall offhand. What system are you all on?
We are on Continuum Care's Welligent.
Well, okay.
Yeah.
Okay. So anyway, that's one of the main things we try to do, is to coordinate kind of a triangle. We put our technical people together someone from your site that is responsible, I would assume that would be Bob, to, answer technical questions. And then with the vendor is the third part of that triangle. And we put them all together when we do these technical projects with sites, so everybody's on the same page about what's trying to be accomplished. Community health record is what we're going to spend a fair amount of time talking about today, and that is the longitudinal record that we had started to talk about at the beginning, where we pull the information together on any patient you're looking for and present it back to you in a unified fashion. And that is what is called this Community Health Record, or CHR. Notify is the ability to receive notices about your patients that you're responsible for when they show up in the emergency room, or they show up in the inpatient setting, or they're discharged from the inpatient or emergency setting. You will receive literally instantaneous notification within just minutes of that. As soon as we get the information from the hospital's admissions and discharge registration area, then it goes into our system, and anyone who needs that notification is notified. And how you receive notification is really up to you. You can access our portal and just get real time whatever we have in the system for your patients. We can deliver the information to you. You can get a text alert. You can get an email. I mean, there's many different ways that we can provide information to you, and a lot just depends on your need and how at risk your patients are on how you want to receive those notifications. We also have direct messaging capability. We are the HIS for a number of different of the vendors, but that really is a vendor driven issue on whether you can set up your system with your own email addresses. Contribution is what Bob was talking about. Very important when we're talking about care coordination is to make sure that as many sites as possible are contributing data so that it goes into the master or into the community health record and is available for other treating providers. And again, we'll talk about some more of that. Data Mart is a kind of a higher level coordination piece where it pulls data on your patients that you work with from every single site that we get it. If you need lab tests, you're missing, especially if you're trying to complete information that you need for reporting purposes on let's just say A1Cs or blood pressure or something. This brings together all that information in one big database by organization, but that is something that I don't honestly think for you all right now is something that you would really need, but just be aware that that's out there. Okay, go on, Scott. I'm just going to run you through this real quickly, and then Scott's going to give you a little more of the technical update on how the data flows. But when we talk about contribution and where data comes from, this is exactly what we're looking at is, as we said, to participation with CliniSync means that you have one or more of the following services. You are having results delivered into your system. You are getting notifications of admissions and discharges. You have access to the community health record. You are contributing data to us. You can query for data on a given patient, or you're using our system for direct messaging. Those are all various ways that you can participate. You can be using one or all of these. I mean, it's whatever your needs as an organization are. And when we talk about data contribution, what we're talking about is we integrate directly with your system, with your vendor. And when you see a patient, the summary of that encounter. So we're not talking about having everything that's in your database, but the summary, what we call the continuity of care document, or CCD, comes back with general information on that encounter that then can be shared with other providers. So Scott, why don't I turn it over to you and you can explain how data flows with what we're doing.
Absolutely. Thank you, Kathy. So let me jump ahead of the slide here. So the way the data flows, originally we focused on data inside Ohio being generated by the hospitals because the hospitals are the generators of data within the community, whether it's lab results, radiology or whatnot. So that was our primary focus, and we started with the delivery of results. And building those linkages out to community providers so that those results, as soon as they were completed on the device, within the hospital, those results would flow out, go to the ordering providers' EHR, flow into their system. At the same time, as Kathy shared earlier, we're building up our own database. We do retain a master patient index where we store demographic information on patients and MRNs from different organizations. Now, the reason we do that is we want to talk to you about your patients using your coding, your MRN numbers. So that way, like if, we get a result from, let's say, Cleveland Clinic, and we deliver that on out into the community, we also store a copy of that or store a link to it to say, hey, we know Cleveland Clinic has a result on Bob. So that way, when you query Bob, we can pull all that information together. We go out to the Cleveland clinics, and retrieve those results and present them as one patient record. Now, that's what we did initially in Ohio to get things started, but we've grown a little bit since then. So let's talk a little bit about, first, let's dive into data contribution. Why is it that you want to contribute your data to the HIE? Well, the first thing that a lot of organizations did is they saw it as an opportunity to improve their own security and workflow processes. Great example is Cleveland Clinic. Prior to the HIE, Cleveland Clinic had to maintain connections with each provider who wanted a result or who wanted that connectivity with them. So they had over 10,000 community connections. With each of those connections comes a risk. You're poking a hole in your firewall. Well, and the same would be true of you guys. If you were going to receive information from other organizations, you're going to have a hole in for every connection. Well, with the HIE, Cleveland Clinic went back and said, hey, we're not doing community connections anymore. We're connected to CliniSync. They went from 10,000 connections to share information to one connection. So that is a huge benefit in and of itself. And also think about if you do participate in any of the value-based programs, which are now starting to, make their way into the behavioral health setting, especially with the private payers. You kind of under those programs focus on the holistic patient, the entire patient. It's all about treating the patient's needs and controlling costs in doing so. By contributing your information to the HIE, wherever that patient goes for care, you're ensuring that we don't duplicate tests, because now they're going to have access to any tests, any information that you guys have already shared with the HIE. So it has a built-in, a cost savings model. We're also, we are integrated with all the Medicare managed payers here, or Medicaid managed payers here in Ohio. We are working closely with Medicaid so that many times the data that you are sharing with us gets shared out with payers. We have also seen a reduction in requests for additional information for payment, because now those payers have that, and we can share information with them and ensure that the HIPAA minimum necessary rules are complied with. So again, sharing your data ensures that wherever your patient goes for care, the clinician seeing that patient has a more complete patient story. All right, so again, we talked a little bit about how the hospitals, we're getting multiple data feeds from every hospital. We're getting the radiology, labs, micro, in addition to transcribed documents, care plans, nursing notes. A lot of that information comes over in a CCD. From our physician practices, many of our physician practices have now began contributing information as well. So we're getting those CCD summaries. So we're going to be able to see, you know, when a patient goes and sees their primary care clinician, or if they go see an ortho clinician, we're going to have those meds, those allergies, those updates. And for you guys, what's critical is the medication information. You're going to be able to see, you know, see those meds that they've been prescribed from all of their other providers. We're also really focused this year on post-acute care. You're getting those documents from them on, you know, as patients get transferred from post-acute, get transferred back into the hospital setting or released to home. We're getting that information as well, and able to send alerts across the care continuum. You know, in addition to receiving all this data, anytime a patient presents at a hospital, we get a little blip that says, hey, Bob's in the ED, or Bob's been discharged, and we can send those alerts out to the providers. So in addition to all that work we've been doing and continue to do within Ohio, we are now getting connected to many of the national networks. So when you query us, you know, we are quickly going out within Ohio and building that record. But now we're also propagating your query out across what we call the eHealth Exchange Hub. The eHealth Exchange Hub was set up a few years ago primarily to exchange documents with government entities that are behind those military firewalls for providing health care. So when we pass your query out to the eHealth Exchange Hub, that goes out on a national network. Anybody else that's participating on that network will answer back if they have information on that patient. But most importantly, that query propagates to the VA and the DoD. And if you've ever worked with trying to get documents from a VA or DoD organization, that's a black hole. Cathy's going to show you how to access those documents within the community health record. One of the greatest things that we have right now is access to those VA and DoD documents. This is kind of a visual of how the eHealth Exchange Hubs work. You know, here's the CliniSync network. Let's say you're looking for Bob Smith. Again, we pull all that data together, all of those links where we know information is. We shout out on the eHealth Exchange Hub, hey, who knows about Bob? Those VA, DoD organizations answer back. Anybody who is a care quality implementer like Commonwealth will also answer back. Commonwealth is one of the national HIEs that some of the smaller EHRs integrate with, because it is an easy integration for sharing information. So we can get that information from there as well. So really what we're saying is not only, you know, while we focus on data within Ohio, we do expand out beyond our borders to be able to present more information to you. And the reverse is true. If you have a patient, let's say it's one of those patients that likes to fly south for the winter, if they are in Florida, if somebody in Florida queries the same thing, if their HIE is part of the eHealth Exchange Hub, then your information will be sent down to Florida for that patient where they're receiving care. So the goal is to be able to provide the patient's story at the point of care that has not only demographic information, but extensive clinical information as well. Again, like I said, we do have the health plans participating with over 6 million lives receiving data and sharing data back with us as well, because we do require our payers, if they are going to be receiving data, they must also contribute data. So we are getting filled pharmacy claims, so that way maybe we can help. You know, our goal there is to figure out a way that we can help with meds management and whatnot. So again, a lot of information, a lot of activity on the network.
Go back to that slide for just a second,
ma'am.
Scott. Tell us, are you all part of Ohio Rise? I don't know if you do all adults or if you do pediatric, or I see, is that Leslie nodding?
Yes, we are part of Ohio Rise.
Okay, then let me just spend just another minute on Ohio Rise, because as you know, even though it came up last July 1st, they're still, building the structure. And we are contracted with Aetna, who runs for the state of Ohio. They're the umbrella organization for all the payers for Ohio Rise. And then there is that regional structure. I want to say 15, 20 regions, whatever it is, where the counties are split up into regions to allow for that referral network at a more localized level. Well, where we are in this, because a lot of what we do is designed to support care coordination, and we'll talk about this again on the social determinants of health later on, but the reality is Ohio Rise, I think, is relying on these regional groups, the CMEs, to contract for their specific region to work with us because we can help coordinate the data in that specific area. So the three newest Medicaid managed care payers have all contracted with us, are all either built or in the process of being built. And as you know, that date, which had originally been December 1st, is now pushed back to February 1st for those new payer contracts. But at this point in time, we are connected to every single one of the Medicaid managed care payers. And so as Medicaid starts fleshing out how they're going to do care coordination for Ohio Rise and actually for some of their other programs coming in, it will include the sharing of data through what they are giving us, and we in turn can provide for them as far as alerts and stuff for the patients that they are responsible for. So this is kind of a to be continued discussion, and we should update you. I'm going to say by probably every 6 months as to where this is in the build process for, especially for your specific area. But just recognize this is a very high priority for Medicaid and the Medicaid managed care payers. Okay, Scott, go on. Now, I just want to take a minute to show you what we're saying about finding data in the community health record, because this is just hugely important to groups like your own, where patients may be coming new to you and you're like trying to put them in context. So Scott, go to the next slide. When we're talking about the community health record, it can be integrated with your system in the sense of, you know, if you have patients that you're seeing for that day, it can be set up to receive information from us. But usually, especially in the behavioral health area, I would say most of the behavioral health providers are using the community health record through our portal. So you've got access either through your system or through, you know, the internet for people who have access on the internet. Then we give you access rights. We work with an administrator for your site, and anybody in your organization who needs access, which can be most of the time it's going to be clinicians, but it's not exclusively clinicians. You can have your administrative staff have access because we have all that information on insurance information, demographics on the patient, contact for next of kin, and you know, all the stuff that may take you a long time to draw together yourself. But if you want your billing staff or your registration staff to have access to that, they can have a more limited HIPAA access, you know, where it'd be on the administrative side and not the clinical side, or you can have your clinicians have access too. So you can get patient demographic, medical history, test results from, as we said, from any place within the state, and actually now pretty much federal, any place nationally that where they might have had work done, as long as they're connected with an HIE, treatment information and follow-up. Okay, so Scott, let's go to the next slide. So this is it's kind of walking you through in a few slides how to find stuff within our system, especially if it's information that comes from outside our system. So it comes from the VA or the Department of Defense if you have active military, Or if it's a facility that may not be part of the CliniSync network, they may be out of state, and you're trying to get information from what was done elsewhere. So this is how you go about getting that information from us. So you would go in, you'd log in, each one of you would have your own credentials. You log in, you just put the patient's name and date of birth or social, you know, it usually just patient's name and date of birth will get you to the record. And then you select the reason for the visit, whether usually it's going to be clinical, non-emergent. You hit that. Scott, next slide, please. And it'll launch you directly into the patient summary. And let me just say, if you're working with us on notifications of admissions and discharges, and you have your patients that you're responsible for, you can just click on their name on that notification and it'll launch you directly into this. You do not have to come back out and, you know, re-enter to get into the community health record. That's all integrated within our system. So it launches you into the patient record. You say you want additional records, and it brings you to the patient summary page. And you know that you want information outside of CliniSync. So let's say you've got a member of the VA that you're trying to find out what type of treatment they've had at the VA level. You would go to the ribbon on the left side where it says documents. And there's going to be a box that shows where it says find external documents. So this means find information that exists outside of CliniSync's own connections and database. Okay, go on. So when you hit that, what will happen is it will bring any documents that they have on that patient, wherever it comes from, that is connected through either other HIEs that we're connected to the federal exchange, to the VA. We're the first HIE nationally to connect to the VA and the Department of Defense, and that was, it's now over 5 years ago. And so we have these connections. We'll bring this information directly to you. As you can see in the box at the bottom, it will show up as individual encounters, and then or individual tests, whatever it is, and you just click to say which documents you want, and then move on to load selected documents. Okay, Scott, next slide. So you then push for a comprehensive CCD. Okay, go on. And then you have the ability either to download the document into your EHR, and you can attach it to the patient's record. You can print it, you know, whatever you want to do to keep a copy of that record so that you can review it. You have that ability. You just, and the nice thing about the community health record is that it is all customizable. So each one of you can set it up so you can see when the patient summary comes up, you can see those areas that are most important to you, and you can limit the time factor as to what time period it will cover for the record. So I think that's really important. The customization is what's going to make it usable for you. Okay, go on, Scott. Okay, now let's talk about a couple of the new initiatives, because I don't want you to go away without knowing some of the like hot off the press type of things. So the two biggest areas that I'd say right now that are going to impact you is what we call the Unite Ohio initiative, which is the electronic referrals, the referral tool. And then what just happened this past week is the release of the federal proposed regulations on 42 CFR Part 2, which includes your drug and alcohol records, and to a certain extent, and behavioral health is not in and of itself Part 2 data, but there are elements of it that could be. So you obviously are going to want to know what is going on in this area. So these are the two latest initiatives, both of which I think would directly impact you all. Okay, so let's go on. The social determinants or social drivers of health in Ohio, we're calling it the Unite Ohio initiative. because this is something that has been and is, as we showed you on the roadmap, is one of our top priorities at CliniSync. We've spent 10 years building the HIE on the clinical side, which, like on the left-hand side, we've got all kinds of information on immunizations, on treatment, and everything else. What our board wanted to do, it's been about 2 years, maybe even a little longer than 2 years ago, because I think we really started it just as COVID was breaking. Needs and initiatives. And so that's really what has pushed us to do the SDOH program. And so I want to show you how that's culminated now that we are at a final point of introducing this in the state. So go on, Scott. Scott, you there?
Yes, ma'am.
Sometimes
Did
this
it not
connection-
advance?
No,
Here.
do
All
you
right.
guys, are you still seeing that one? Okay, wait.
Yeah, let me
okay.
reshare here.
Okay. Yeah.
Yeah. Working out?
All right. There. Yeah. Now we're good.
Awesome.
Okay. So our board wanted us to do as an organization is to take our ability to work with all these sites with data and convert it into something that will support population health initiatives. And so it was really seen that SDOH, and especially in the early days, we were looking at maternal health initiatives because Ohio had such horrible, horrible results on maternal health, that really was driving this initiative. But as we've gotten into it more and more, because it's been well over 2 years since we've devoted a huge amount of resources to this, we realize the need is not just maternal health, but health of just about everyone, because 75% of all health outcomes are affected by social determinants of health. And so the end goal for what we were trying to do is to develop an aligned approach around the state for how SDOH is being handled. And so as part of this, we wanted to offer a tool that would be able to document and be able to support your needs in the programs that you were involved in. And this is something that we are coordinating across providers, health systems, have been in intensive discussions with Medicaid about it, with the Department of Health. The whole idea is to be totally transparent and to make this available to as many groups as possible in a realistic and cost-effective way. So Scott, go on. So where we are is it took us 1.5 years to set up a multi-stakeholder group that would give us input into what needed to be looked at if you're trying to do referrals electronically for areas other than just clinical, where you're referring either, for example, in your area, in and out of behavioral health for those needs, for food needs, for transportation, for very specialized medical needs. These are all things, these groups all came together, gave us input, helped us to winnow the list of specific vendors that could be involved to, I think we ended up with 4, and they eventually ended up and when that says behavioral health, NetCare is not the only behavioral health group that was involved. We had plenty of behavioral health providers. That was just the vendor there. Okay, go on. The final master agreement has been contracted with Unite Us, and CliniSync is the holder of that contract. Medicaid in the state of Ohio are contracting separately, mainly because, as you know, every county in Ohio has its own separate government, its own separate finances, and it is virtually impossible to do anything at a statewide level for the county. So I think Medicaid's working on getting that piece done. But this is the message for you all, is that as part of what we're doing, part of our commitment to population health in Ohio, is we are offering this very sophisticated referral tool, which has a lot of analytics in it, to behavioral health and to the FQHCs, free of charge. So our involvement is to coordinate and work with the payers and the health systems to be able to offer this to our other, what we call our at-risk providers, because we feel like you of all groups would need to have access to this type of tool to both document what you do and to help do care coordination in the behavioral health area with all the other providers. And we all know that's what Medicaid is wanting to see in those managed care contracts that just came in the new round of contracts. Literally every single page of those contracts had care coordination written on them. And so this is a way to support that care coordination. It's taking us, it's going to take us several months to get everyone educated on how to do it and how to move through it. But what you all should know, you're already CliniSync customers. And so as CliniSync customers, you will receive an addendum to your contract with us that you just need to sign and send back in. So you don't have to do a whole new round of documents and contracts with Unitas or anything. You can just merely sign once with the addendum for CliniSync, and then we can start the education and work with you on getting that up-to-date referral tool going. So let's show you just a slide or two about that, and we'll have plenty more education for this. We just wanted to make you aware of it. So Scott, go to the next slide and let's look at that. This is one of the ways that I don't know if any of you have ever seen Unitas. I had not seen it until we started vetting the vendors. And I was just amazed at the way that they can take the data on referrals and break it down. So it can be done by category. You can look at your referrals you've done for whether it's food, housing, some type of, you're sending them to other healthcare providers, whatever the need is. And we are working with the 211 systems, and we're working with the Area on Aging to get their database for referrals. So when you look at that, and Unitas is already working with us on the Ohio RISE program, because we have said to them, Ohio RISE is set up on a regional basis. And so we need our providers to be able to, when they're looking to do referrals and they do drop downs, they want those drop downs by region or by county, because that's what you all are going to have to do. And Unitas has assured us that that is a way that the information can be presented to you for referrals. So, and when we do a more in-depth review or demo of the Unitas platform, you'll see exactly what I mean. So Scott, go to the next slide. So that's how you can refer out. But I know everybody and their brother, especially if you're working for the Ohio RISE program, needs to have data back in. You need to be able to construct reports about what you've done, how many patients you've handled, what the breakdown on the demographics are, where you've referred, how many of those have been closed. And that, I know that's hard to see because that's a small slide, but basically you can customize your reports to get all that information in. Those are pre-built reports, but if we find out that we need to have other reports built, we will work with Unitas and with sites that tell us they need something else. Excuse me, let me just grab a little water here. So, Scott, go on. Okay, and then the last thing I do want to tell you about, since it is the very latest, is this proposed rule on 42 CFR Part 2 changes. And that just came out about a week and a half ago. I mean, it literally was just last week. It's still in comment period. It's going to be in comment period until January 23rd. And as I'm sure you all are aware, we have waited, what, like 2 years to get them this far, because the CARES Act changed the consent process for Part 2 data to basically say, if the patient gives that initial consent, then that data can be transmitted and it becomes like HIPAA data. You know, you don't have to have constant consent in order to send that to another provider for care coordination purposes. And so it was really important that this rule come out. And the Office of Civil Rights and SAMHSA are not the fastest in the world when it comes to doing updates on HIPAA and Part 2. Oh my gosh. I mean, literally, SAMHSA can take years to get a final rule out. But this one is linked to a change in the statute. And so we believe that it will be finalized. You're going to have to wait until the comment period is closed. And then it's probably going to be several months before it's final. But we do believe that it will be final within the next year. And it gives us an idea of where we're headed with them. And the nice thing is that CliniSync had worked with behavioral health providers. I don't think you guys are part of that group. I was trying to think back of who all was involved in that. But about a year and a half ago, when the CARES Act first came out, we got together with behavioral health providers in Ohio and crafted a letter to SAMHSA and to HHS with our advice. It was kind of a combination of technical advice and behavioral health advice on what we felt, recognizing the change in the CARES that they didn't write something that we weren't going to be able to do. I mean, you know, basically, because that makes me very nervous when the federal government gets into electronic standards. So we worked with OBHPN and some individual providers to craft, I think we had like 6 main points that we said, you know, this is how you're going to have to handle data if you're going to make it flow correctly. And we didn't hear, and we didn't hear, and we didn't hear. And actually, our letter we sent to SAMHSA was picked up by a national behavioral health organization that was lobbying for behavioral health at the national level, and they incorporated the comments into their letter. And we still didn't hear anything back, and we were getting really discouraged. Well, the rule comes out last week, and lo and behold, our letter is quoted twice in the rules. So they actually had taken note of what we were saying should happen to make this a process that would move ahead smoothly. So that to us was good news, but believe me, we're not home yet, but we're getting closer. So that's good. But let's go on, Scott, to the very last slide, and then we'll open it up in the next few minutes. Just remember, I know you guys, you are probably our most knowledgeable providers, behavioral health, on restrictions on data. I mean, that's just part of what you do. But we have to constantly remind people that behavioral health data that comes out of the emergency room is not privileged the same way that you might see with other data from other sources. Like, it's not a Part 2 facility. Emergency room data, by and large, is totally open data. So if you have a patient who's been in the emergency room and you need to know what was done, if they have drug issues and you wanted to know if there was an overdose in naloxone, you can get that information. If they're having a behavioral health episode and you need to know what the diagnosis was and what type of testing was done, you can get that. So that's one of the great advantages of using the community health record, is getting that information on what has happened in the emergency room. I think for all the behavioral health sites, that's probably the number one need. And I'll tell you right now, just between you and us, that we have met now several times with the state of Ohio's OMAS program, as you know, drug and alcohol, to talk about getting Ohio's inpatient behavioral health facilities as part of the network, so that it could include admission and discharge information from there. The big holdup there is they are looking at going with a new technical vendor. And so we're going to have to wait on that, but I just wanted you to know that we know that you're great. Of Ohio. So we hopefully will be able to help you with that. But I just want one last reminder here is even if you have a patient whom you've created psychotherapy notes for, you are still being expected by CMS and by HIPAA to share the rest of this information, medication, prescriptions, diagnosis, functional statement, treatment plan, prognosis, progress, stuff like that. So we can go into that at a later point in time, because I want to leave a few minutes for questions. But, you guys are probably our top priority this year is going to be behavioral health and drug and alcohol. So if you have anything that you need us to do or to find out, please let us know, or anything you want to comment about in the rules when we send back comments, let us know. So thanks for your attention, but do you all have any question? I thought I saw somebody had.
I just added a comment, Kathy, that I thought that that would help the inpatient psychiatric facility joining this would help with the Ohio Rise clients, because that's huge for them.
Yeah, I think that is really, the Ohio Rise program would dearly love to see that, because of all your most at-risk patients, the Ohio Rise kids are going to be as high risk as anybody. So yes, I wish I could say that I can move them along faster, but you know how long it takes the state to do anything. And when we're talking about a new technical contract, that's really the holdup. But as soon as they get that, I believe they're committed to doing the admission and discharges, because that's actually required under federal law. I mean, under the whole ADT area, it's been a couple of years now, but they specifically called out psychiatric hospitals as being ones that were going to be expected to share admission and discharge information. So anything else that I can answer, like on the fly? And then what we'll do is turn you over to Billy, and Bob, put you and Billy together and Leslie, and decide how you want to proceed with setting up an administrator and getting whatever services you want. But
yeah, we actually worked with Billy some time ago when Shai was set up as our administrator. So yeah. I think at this point we just need to go in and update some information and kind of get updated with our patient panel on Notify, and some house cleaning we need to do there.
Yeah, Billy's doing a lot of work in your area. He's like our primary person in the
he's been great to work with.
Yeah, so he can really just do anything that you guys need done to connect. So that is really good news for you all. But so if you all don't have any other questions, Bob, thank you so much for setting this up, because as I said, the timing was perfect.
Yes, thank you. I want to reiterate with our group, as you can see, Scott and Kathy are both very knowledgeable. They've always been great folks to work with, and they're just a great local resource that we have at our disposal. They're very responsive, And I just want to reiterate with everybody that, there's the valuable resource that we have right here in our backyard. And I look forward to, engaging with you guys going forward. And hopefully at some point, right now for our group, we're mostly involved with accessing the community health record. We do have Notify in place. As I mentioned, we've got some cleanup to do there and some workflows we're trying to establish down at our outpatient center to better streamline that. But eventually, I hope that we can be a contributor to the community health record as well.
Yeah.
So
Me
we really,
too,
really
especially
appreciate
as
all
we-
your efforts.
Yeah, as we get all this sorted out so people understand the Part 2 stuff and what is and isn't covered. And we've been working with the behavioral health vendors now for a couple of years to make sure that that all is happening correctly. So we will work with you all without a doubt.
Sure.
Okay.
Much appreciated. Anybody in our group, questions, comments?
Just thank you again.
Yeah. Oh, thank you. You're quite welcome. We're happy to do it. You've got a great guy with Bob working on this. So we'll just move ahead and contact you directly on getting going again. Okay. Okay.
Thanks so much, Scott, Kathy.
Thanks all.
Hey,
Have a great
Appreciate
day.
your time.
Thank you.
Thanks,
Bye-bye.
Kathy and Scott. Bye-bye.
Bye.